presented by the group benefits team at Walsh Duffield, and we're happy everyone was able to join us remotely today. We'd normally be seeing you in person, but this year we're not going to have our regular benefits fair, so we're going to pick some of the topics and the speakers that we're going to be part of it and share it with you over the course of the next month. We're clearly hoping to be back together in person in 2021, but we're going to share a lot of good content over the next month, and we'll get feedback from you, and you can help guide us as to other future topics and speakers. Before I introduce Frank, I'd like to cover a few housekeeping items. Today's webinar is being recorded, and we'll be able to share a link with you after the event is complete so that you can share it with others and you can revisit any of the content yourself and share it with colleagues. Today's slides will also be available to share with you. And we invite your comments and questions. And you'll notice at the bottom there's a Q&A chat box on your screen. If you'd click on that at any point during the presentation and send a question or a comment, Stephanie and Rebecca will be going through that, and Stephanie at the end will lead any kind of a question and answer session with Frank. And we're going to leave a lot of time for that because that's sometimes where we learn the most. Frank's, as all of you know, because many of you have been coming to our annual benefit seminars, is one of the very talented individuals at the Business Council who helps us in lots of different ways. He's been a strong advocate on labor, HR, unemployment insurance, workers' comp, and human resources consulting service to Business Council members. He's a graduate of Cornell University School of Industrial and Labor Relations and has 35 years of experience in human resource management. We're very pleased that he would take the time to participate in this and give us the wonderful guidance that we look forward to. So Frank, why don't you take it away?
All right, thanks Ted for the kind words. I always look forward to partnering with Walsh, and I'm going to be sad that I don't get to make the trip to Buffalo for the benefits fair. It's always one of my favorite trips of the year, and it's a great place to visit. I love being able to get out there more often, but we're all been closer to home in light of the events of the last nearly 3 months now. And that's what we're going to talk about today is how we're recovering now, what's going on. As Ted mentioned, I'm part of a team at the Business Council. I'm part of the Government Affairs team, and I'm an HR person by trade. So I focus on sort of the human resource aspects of this virus and what it's done to employers and the reopening part of that as well. So I'm going to cover sort of the reopening from that HR perspective. I'll talk about the guidance that's coming from the state on what we have to do to reopen and how we have to protect ourselves and our employees. And I'll also cover a couple of HR issues that have popped up that we've noticed as we work with the governor's office and the legislature and the regulators that I think are important to remember. Some hot spots. The benefit of the Business Council is that we are the go-to voice in Albany for business. So we have direct lines of communication with the governor and his council's office, the legislature, and the Department of Labor, Workers' Comp Board, all the relevant regulators. I'm going to apologize in advance. It's my allergy season, so if I have to mute for a second, that's what I'm doing. It's not COVID related. So to get going, first, I'm going to be giving legal, tax, and medical advice, and I'm not qualified to do any of those, right? So it'll be a disclaimer here that you can't hold me to it. And there are going to be times when I'm going to refer you to medical professionals, attorneys, and tax professionals, because all of these have been covered under this unique period of time we've been in. As you know, when you think about it, in March, we closed down our economy and we went through some traumatic things. And human resource professionals have been amazing during this process. You implemented 3 new paid time off programs with no implementation time. You've become employee health experts. You've gone through layoffs. All these things that in and of themselves would be significant human resource duties, you did seamlessly, and we still have more work ahead of us. So when we talk about reopening New York State, you've all become familiar now. I don't know if you're tuning into the governor's daily press events. I do because I have to. I hope you don't all have to sit through all those. But as you know, we're broken down into phases by industry, and we are also broken into regions. And as our region meets certain metrics that the governor has determined are important in terms of infection rates and hospitalizations, then different phases get to open. As these phases open, the governor's office puts out guidance, and it's called guidance because it's not law. But in the guidance, it talks about things that you shall or must do. And when you hear that, we've, again, in our conversations with the governor's office, it's clear that some of this is mandated and enforced through public health law. So we'll touch on that as we go to those different aspects. If you haven't heard, phase 3 guidance is now available. The guidance is published as phases begin to open, and it goes onto a website. I'll give you that link in a second. So they're doing a little better job at getting the guidance out in advance of the phases opening. So when your region has met the criteria and when your industry phase has arrived, you have things to do. And all employers have things to do, essential or not. And I'll talk about that in a little more detail. There's a key website you have to go to every day, and it's forward.newyork.gov. And this will take you to the governor's website. As we mentioned, it seems like a pretty planned out reopening process, but in reality, it's not. There's a lot of impromptu things that happen. The governor decides on a whim that, for example, we can hold graduations with a maximum of 150 people, or dentist office can all of a sudden open statewide, regardless of whether your region's open. So things happen frequently and outside the normal schedule of events. So always go to this website. Anyone who's in an industry waiting for guidance should go there on a daily basis. When you go there, you'll find 3 important things for each industry. Interim guidance, which outlines your activities as an employer and what's expected of you in the reopening in this new environment we're in. This guidance is a long one. This is, for instance, if you're opening an office, this guidance was in phase 2, it's online, it's 12 pages long. At the end of that 12 pages is a link. You have to click on this link. Every employer has to click on the link for their industry and affirm that you have read and understood the guidance and that you intend to comply with the provisions of the guidance. So everybody has to do this affirmation. This will come up again. There's a summary guidance, which is sort of a chart, nice handy place to look at what you need to do and what you should do. And then finally, there's a reopening safety plan template. If you don't want to reinvent the wheel, if you want to use a template that's online, it's a fillable form, you put in your specific information, and you would have a reopening safety plan. And that's key. Every business has to have a written safety plan. And we'll talk about that in detail in just a second. So if I'm an essential business, what do I do, right? I've been working all this time. I've been fully staffed. I've been doing things, according to the way I've always done them. Do I need to pay attention to this guidance? And the answer is yes. And in this guidance, I guarantee you are things that you haven't been doing for the last 2.5 months. So you're going to have to adjust your work situation a little bit to comply with the guidance. One of the key things you're going to see in most of the guidance is a 50% maximum occupancy. The one thing that's clear is that if I'm an essential business, that does not apply to me. An executive order was done that said essential businesses can work in a way that's safe to maintain the essential business. So if I've been working fully staffed, I don't all of a sudden have to reduce my staff in person to 50%. That's covered by an executive order. You have to comply with the guides and you have to affirm. So you have to go to that link and affirm that you're going to comply as well. We asked the governor, well, how soon do they have to do that? If I'm an essential business and I've been working, do I have to do this by the date that my phase is open? The answer is no, you have to do it as soon as possible. And if your guidance isn't published yet, and so far we don't have phase 4 guidance, if you're a phase 4 business and the guidance hasn't been published and you're essential, you just keep doing what you're doing until the guidance is published. Now, if you're a non-essential business and you've been waiting to reopen as a result of this, you have to make sure your industry and region has been approved, right? You have to adopt a written reopening plan. As I said, it has to be in writing. You have to fully implement the plan before reopening. So you can't, for instance, the Business Council reopened this past Monday. We have a reopening plan, but it would be inappropriate for us to open on Monday and say, the gloves and masks we were told you we were going to provide, our order didn't come in and they won't be here till Wednesday. Well, if we can't provide the personal protective equipment or the cleaning materials we need to comply with the guidance, we can't open up, right? So make sure your plan is fully implemented before you reopen. We have to affirm that we've read and understand the guidance, and make sure you stay current, right? We need to make sure that things change on this guidance, criteria change, requirements change. You need to make sure you're paying attention to those. So about the guidance itself. Each guidance for each industry, as I mentioned, food service just came out for dining, inside dining, are going to have some very unique industry-specific criteria, right? That makes sense. If you're the barber salon, the barber shops or the salons that are opening have very specific criteria about reusable capes and things like that. But 90% or more of the guidance across all industries is the same. It's broken down into people, places, and processes. Governor loves alliteration with these things. So we got the 3 Ps here: people, places, and processes. And so I'm going to go over this, and this applies again to 95%. This will apply to every industry, and then you'll have some additional industry-specific things you'll have to comply with. Physical distancing, right? We all know that it's all about stopping the spread. And to do that, we need to stay away from each other, and that's the point of the 50% maximum capacity. You are going to allow your staff to come back up to 50% of maximum capacity, and that's determined by your certificate of occupancy. So if you own a building, someone's got to dig out the certificate of occupancy to try to find out what the maximum number of people allowed in that building is. If you're a renter in a space, you need to get your landlord to get you the certificate of occupancy for your space. That's the number you're limited to. You know, interesting, our office space at the Business Council is such that we have 50% of our certificate of occupancy is more than 100% of our staff. So even if we all showed up at one time, we would not be exceeding the 50% maximum. So you need to know what that number is. Interestingly, they'll put things on here about unless more needed to safely operate your core functions. And this is key. If you need more people, if you're unable to social distance, but it's essential to maintain the core functions of your business, then you can do that as long as these individuals are working safely, right? And so how do you do that? Face coverings is the first place, right? We've all heard about masks. We all have our own customized fancy masks now that we wear all the time when we leave the house. Face coverings would be required if you can't maintain social distancing, or you can't maintain below 50% and your people are forced to be closer together, then face coverings are required. I'm going to talk more about them in some detail in a little bit. Physical barriers between workstations, same thing. If you have an assembly line or a warehouse facility where people can't physically be 6 feet apart, you need to look at providing some sort of barriers maybe between individuals in this case. Prohibit the use of confined spaces like elevators, conference rooms, company vehicles. You're either going to prohibit or restrict the use of those. I was in an elevator recently where they had the 2 squares on the floor where you're supposed to stand with your mask on, and it was limited to 2 people. We're going to have to monitor that. One-way hallways, I always like to say, we have some big guys in the government affairs department, and if we're going down the hallway, it's clearly impossible to keep 6 feet social distancing. So we're going to look at instituting a one-way hallway system because of the layout of our facility. Not required, but just a suggestion as a way to minimize contact in the hallways. And signage, you're going to need lots of signs. You're going to have to remind people to wear face coverings, to wash their hands, to cover their cough and sneeze, to clean office equipment when they're done using it. You need signage, and you're going to have to communicate to employees what the new requirements are, and that requires signs. We developed some for the Business Council for our internal use. We like them, so we put them on our website, and they're available to anybody for free. If you want to go and just download them and use them, feel free. They look nice. Or you can design your own or find your own provider for those. And so this sort of concept here we're talking about on this slide is OSHA's preferred method of protecting employees, right? They always talk about 3 things with OSHA and that they should be done in this order. Engineering controls. We should redesign the job so that the risk is gone, right? And so an example of that is to limit everybody to 50% occupancy. That's a good engineering control. That's going to help reduce the risk. Second are administrative controls. We're going to write rules that employees have to follow to minimize the risk to themselves. So we're going to prohibit who's in the conference room. We're going to have one-way hallways, things like that. And then finally, personal protective equipment is our last line of defense. And so that's why we have masks and, if necessary, gloves and some other things I'll talk about as we go through this. But that's where we start. Again, we're going to limit gatherings in enclosed places. You know, we're not going to have meetings like we used to have meetings before. We're going to have some rules and some practices surrounding the break rooms and lunch rooms, right? If you have an area where people go where there's a refrigerator, a microwave, the coffee maker's there, you're going to have to limit occupancy to that room to ensure 6 feet of social distancing. We've limited occupancy in our break room to 2 people. It's, you know, the size that we can do that safely. And to reinforce that, we took the chairs out of the break room, right? We don't want people congregating in any particular place. So taking the chairs out of the lunchroom is going to do that. Not everybody has to come to work, have lunch, or have breaks at the same time. Let's stagger those so we don't get people congregating in the different locations. Let's limit in-person staff to only those necessary. If you have been able to work successfully from home, and some businesses have, then you should continue to do that where possible. Obviously, some positions can't work at home and can't continue to do that. And some individuals don't work successfully from home, if you know what I mean. And if we're worrying about productivity or about their the extent to which they're paying attention to their job when they should be working, then maybe we bring them back, right? And then the last point here on this slide is movement and commerce, they call it. And that just means we have so many new responsibilities related to our employees, right? We have education, communication, we have signage, we have to provide them personal protective equipment, that we really need to limit non-employees coming into our place. So if the UPS delivery comes every day, we're gonna leave that outside a door, right? We're gonna find a way to handle that without them coming in the premises. If you have a loading dock situation, we're gonna try to find a way to keep those individuals away from our facility. If people do have to come into our facility, we're going to have visitors logs. And we've all been to those office buildings that log in who comes in as a visitor. We all have to do that now, and I'm going to mention that again later when we talk about some new obligations that employers have. So limit non-employees in the workplace because we're responsible for their safety. So if we can limit them from coming in, that limits our liability that something's going to go wrong. Personal protective equipment. Face coverings are all the rage, right? We're all in the world of masks now and wearing masks. As you know, the governor back in April signed an executive order that required employers to provide face coverings to their employees at no cost to the employees. We also have to provide those to contractors. So anybody who's working in your place, we need to make sure that face coverings are available. If we're going to require visitors to wear them, I think we should provide them to visitors. But the bottom line is employers are responsible for providing face coverings to employees at no cost. Now, once we do that, we have some additional responsibilities. Our first responsibility is to make sure maintenance, cleaning, and replacing of face masks occurs. What we clearly want to do is we want to encourage employees to bring their own face coverings, right? We want people to be comfortable at work if they have bandanas or gaiters or masks with their children's picture on it, whatever. We want employees to come to work, be comfortable, be healthy, and wear the mask they're comfortable wearing. But as employers, don't forget we have responsibility to make sure it's working. So if Bob comes in and he's wearing a mask that is one of the paper surgical masks, and he's been wearing it every day for 2 weeks now, and we can see how grim it's starting to look, we need to intercede with Bob and have a conversation. You're like, Bob, you know, we love you. The mask is great. You're doing great wearing the mask, but it needs to get replaced. It's no longer effective. Here, we'll give you a mask or come up with something of your own. The guidance says specifically that we shall not prevent employees from using their own personal face coverings. And this is an important bullet, and I'm going to explain why. And this is where I go off on my N95 rant. During the whole course of this pandemic, the N95 mask has been held up by the media and by almost everyone you listen to as sort of the gold standard of masks. If we could only get some N95s, if people could have N95s, we'd be safe. That is not true. In fact, the opposite is true. The N95 mask, and masks are graded on a number and letters system. There are higher numbers in this. There's N99s. There are additional types of respirators. Are just that. They're considered respirators by OSHA, which means they make breathing a little more difficult than just a plain old surgical paper mask or a bandana. Because of that, these masks pose a risk to employees. So much so, OSHA considers them a hazard to employees who have to wear them. If you have an employee, so we have an employee, we say, everybody bring your own mask. Everybody can wear what they want. Bob shows up. I'm going to keep picking on Bob today. Bob shows up wearing an N95 mask. So as employers, you have to know what that looks like. So go Google N95 mask images so you get to know what that looks like. Bob shows up with an N95. We have to talk to Bob again. Bob, why do you think you feel the need to wear an N95? Well, I have COPD, or I have diabetes, or my wife is getting cancer treatments and she's in the vulnerable population. This is now an individual with a disability asking for an accommodation. So as an employer, we have an obligation to get involved in this interactive process, right? Just like under the human rights law or the ADA, we have to find out if we can accommodate this, because if we cannot, we have certain things to do under OSHA, and failing to do that can result in fines, and OSHA fines get really big really fast. If we allow an employee to wear an N95, we have to have a written respiratory standard plan. We have to send Bob for a medical evaluation to see if Bob is healthy enough to wear an N95. We have to have a certified individual fit test the mask to Bob to make sure it fits appropriately and not causing him more harm. We have to do annual training for Bob so that he knows how to wear an N95, how to dispose of it when it's lost its effectiveness. If we're not in the mask business, if we're not a healthcare provider or a manufacturer that requires an N95 because of the contaminants in the workplace, we don't want to do any of those things, right? So we want to the best of our ability, not let employees wear N95 at work. So we need to look into a reasonable accommodation. Bob, would you mind wearing another mask? How would you consider working at a different shift so you don't come into contact with as many people? How about you continue to work from home? Or bottom line, how about you don't come back to work wearing the N95? As an employer, we have to decide what is a reasonable accommodation in this case, but N95s can be dangerous to the people who wear them. They require a huge administrative burden on employers, and we need to find a better way. So that's my N95 soapbox. As I said, I think if a box of N95s fell on your doorstep, you'd be handing them out like, hey, we won the face mask lottery. Everybody take one, when in reality, that's a problem. So I go to the grocery store and I see elderly people wearing N95s who I can tell aren't healthy enough to wear them. And my wife has to restrain me from saying something. So I'm like an N95 terrorist walking around. But anyway, that's my soapbox about N95s. We're going to continue to limit sharing of objects, right? Tools, machinery, any type of equipment, vehicles. We don't want to spread it that way. We're going to train employees on putting on and taking off personal protective equipment. Masks are pretty simple, right? But if you're in a business, again, where you're not used to wearing gloves in the workplace, and now you're requiring employees to wear gloves to protect themselves from the droplets, they need to know how to take off gloves in a way that reduces their risk to them. Anybody who works in healthcare knows that there's a specific way to remove latex rubber gloves to prevent the droplets or blood or whatever from going everywhere. So when I see, McDonald's or Burger King employees wearing gloves where they didn't before, I'm hoping that they have had training on how to protect themselves when they take those gloves off. Masks, as I mentioned, I don't think are any big deal. We can continue to wear those safely. People are comfortable. You don't get the spray of taking off gloves, as you can imagine. Hygiene and cleaning, we're gonna clean, right? We got to clean our facility all the time. We have to clean our facility in such a way that it keeps people safe, and just as importantly, shows employees that we really are trying to make returning to work as safe as possible. When I hear employees say, I'm afraid to come back to work because of the possibility that I'll catch the virus, I almost take that as an affront to me as an employer for not protecting them. We have cleaned your facility. We're going to provide you everything you need so that it's safe when you come to work. So make sure you understand the CDC guidance about hygiene and sanitation. We have to make sure employees can wash their hands at work, right? So we need soap, running warm water, and paper towels in the workplace. If we can't do that for whatever reason, they're out in the field, they're in their vehicles, we have to make sure they have alcohol-based hand sanitizers. We have to make sure there's appropriate cleaning and disinfecting supplies for shared touch surfaces. So for example, if you're going to let employees use the microwave and the refrigerator and the water cooler and the coffee machine, that's fine. If you can make sure that there's wipes there, there's signage there to tell them, to remind them to clean it, and that they do it. At the Business Council, we're giving them a chance. We're giving employees a chance to continue to use those pieces of equipment, those shared touch surfaces. But if we see that they're unable to follow the rules and clean these surfaces after each use, then we will prohibit the use of that equipment in our workplace. Clean and disinfect your work areas on a regular basis, including restrooms, equipment, tools. You have to keep a log of this, right? The standard requires that you log all your cleaning activities. So if you're doing it yourself, easy to log. If you have a professional company doing it, they should be keeping a log. That's part of their guidance. If your landlord is doing it, make sure you have access to his log in case your county health department comes in and wants to look around. We're going to prohibit shared food and beverages, right? We're not going to say, everybody, we're open on Monday. We're going to have bagels in the break room for everybody. You can see the obvious risk there. First, congregating, and then secondly, we're sharing shared touch surfaces. We don't want to do that. No more pizza day on Friday, which is a big hit to my Friday afternoon routine. But we all have to make sacrifices, I guess, as we move through this. What happens if we have someone who tested positive in the workplace? Bob calls me today. I'm going to pick on Bob again. Frank, I tested positive for COVID, and I was in the office yesterday, or I was on the shop floor yesterday, or in the warehouse yesterday. Now I got a COVID positive diagnosis. We as an employer, well, first of all your other employees are going to know this, that Bob is tested positive, and they're going to look to your reaction to see how you're going to clean and disinfect this area. We can close off Bob's area. We don't have to close the whole building down unless that's what Bob did. If Bob was everywhere spewing droplets, then maybe we do have to close everything. But hopefully we can just close off a particular area and do our cleaning and disinfecting there. The CDC has guidelines for how to do that. I think they say wait 24 hours before cleaning and disinfecting. I'm not sure what they're going for there, hoping the virus dies. I think we should treat Bob's work area as if there was a blood spill, right? And if there was a blood spill there, we would get to it and clean it up. Those who clean have to know how to protect themselves from cleaning. So I think it's unfair to assign maybe a regular staff member to that task without providing them training, personal protective equipment. But how you do that, you need to have a plan on how you're going to clean Bob's area when he calls you and tells you he's COVID positive. Do this in a phased way. As I said at the top, this was a traumatic event in March. People really had to change the way they live and work. We're bringing monitors home for those who were lucky enough to work from home. Some found themselves unemployed. There was a lot of trauma on March 20th or around that time. This is going to be almost as equally traumatic. There's people who are fearful of returning to work, who have loved ones or new grandchildren at home, like I do. I have a new grandchild. Who are fearful of bringing the virus back home. Let's make sure we give our employees time to adjust, express their concerns, and address them, right? You guys are all good at that. You did a great job in March when all this started. I'm confident you'll do just as great a job in June and July as we open. We have to communicate our plan. This is one of the requirements of the guidance. Employees have to understand the plan. Visitors and customers have to know. You've seen other industries, retailers who have signs up all over the place, 6-foot social distancing, wear a mask, everybody's doing this. We know what it looks like. Our place of employment has to mirror that. We're going to use training, social media, email, everything we have available to us to communicate this stuff to employees. Processes. The most significant burden I think that's been put on employers, excuse me, is this new mandatory daily health screening. Eventually, every employer in the state will have to ask every employee 3 questions every day. Have you knowingly been in close contact with someone who is COVID positive or has COVID symptoms? Have you yourself tested positive for COVID in the last 14 days? Or have you experienced COVID symptoms in the last 14 days? And that includes the 100.4 degree Fahrenheit temperature, cough, shortness of breath, and there's some other ones listed on the CDC guidance. So every employer has to ask every employee every day these 3 questions. This is one of the requirements of the guidance. This is in the mandatory section of the plan. So how do we do that? It doesn't give us much advice. The governor's office has not given us much guidance. No one wants to be really held responsible for making decisions on this. Two things are clear. One, you have to review and evaluate the process, right? Whatever process you put in place, you have to evaluate that it's working, make changes if you need to, and then document that evaluation. So you got to take notes on how you do that. And secondly, you cannot retain employee health data. We can't create a file of employee health information. We couldn't before COVID-19, right? Before this, we couldn't run around and ask our employees if they have a fever or cough or shortness of breath. What that does, it would lead to patterns of record keeping that could lead to discrimination based on a disability, right? So that's why employers were prohibited by the EEOC and the ADA and New York State human rights law from doing physicals, to try to determine those things. But we have special dispensation under the COVID pandemic, but New York State's guidance specifically says we are prohibited from maintaining employee health data. We have to make sure employees know that if their answers change to any of those questions during the day, they have to let their supervisor know. Now you can take daily temperature checks. A lot of employers are doing that. As employees come in the workplace, they are taking temperature checks. I have some concerns about that. My first question is who's doing it? If you have an employee health department and you have an employee health nurse or physician on staff in your organization, then fine, go ahead and take temperatures. And we know some larger employers are doing that, right? They have employees who come in on the shift. They have a health professional they've paid to do this, who's taking the temperature and asking these questions. That's great. But I think for the vast majority of New York's 450,000 employers, that's probably not practical. I think it's unfair to ask a coworker to do it because now we're expecting them to be within 3 feet of someone, take a temperature. If that's the case, if you made me do it, I would insist on a face shield, not just a mask. I would want a gown to protect my clothing. I don't take anything home from my coworkers. And I just, I'm not comfortable with the training on the machine, asking the questions. I don't want that job. So I think there's a lot of downside to doing daily temperature checks. So how are we seeing employers do this? We see a spectrum of things that are happening. We have some large retail members of the Business Council and organizations in the state with multiple locations, with multiple start times, with warehouses, with retail stores, who are taking what I like to call this passive attestation approach. That is, I'm going to communicate to employees. I'm going to put up signage. I'm going to train employees as part of our training that if they answer yes to any of those questions, they cannot come to work. And so by the mere fact they're coming to work is an attestation that they have answered those questions and are okay to come to work. That's how some employers are doing it. We have other employers along the spectrum who are using a paper questionnaire every day. Check 3 boxes, sign your name, throw it in a box. Again, we're not going to retain those records. We're going to get rid of that box by the end of the day. We have some who are requiring antibody testing before they return to work. And we have some who are requiring COVID tests as a condition of coming back to work. All those have obvious drawbacks and questionable usefulness for employers. So I think you got to find where on the spectrum you want to be in doing this daily healthcare assessment. For the passive attestation on this end of the spectrum, that I mentioned those retailers are doing, we talk to the governor's office every day and we try to get their attorneys to give us opinions. They try not to give opinions because they're attorneys. So they try to dodge the question. But I have had attorneys in the governor's office say, quote, I can live with that. But that's as far as you're going to get from legal advice on me. No guarantees. The other significant obligation employers have is we're now part of the contact tracing portion of this pandemic. So if we have a positive employee, we have to notify our county Department of Health, the county in which we're located, by picking up the phone, call the county Department of Health and say, Bob Smith called me today. He said he tested positive for COVID. I have a couple concerns about this. I'm not giving Bob's social security number for sure to the county Department of Health, and I'm not giving Bob's address. I think this is information that we as employers are obligated to maintain confidentiality in regards to, so I wouldn't be giving out that information. Someone's name has to be on the plan. You have to have a site safety monitor for your written return to work plan, so the people know who to talk to. And you have to maintain contact logs, as I mentioned, for the contact tracing portion of our new obligation. If you have people who, you have to be prepared on what to do when these scenarios arise. You have an employee who tests positive, they're going to be on a 14-day quarantine. They're positive but asymptomatic, 14-day quarantine. They're symptomatic and after they've had contact with someone who's positive, my wife had it, let's say my wife tested positive, now I'm developing a cough, 14-day quarantine. So be prepared to adjust and respond to each scenario as they pop up, because you're probably going to have those. As I mentioned, we're now part of the contact tracing system. Cooperate with your local Department of Health. If they present and want to see your plan, want to walk around, we should cooperate. And make sure employees know that if you're subject to a quarantine or an isolation order, they have to let their supervisor know. You know, through the contact tracing process, I've been exposed somewhere else besides work. I've been isolated. It's my obligation to let my employer know. You have to post this conspicuously on site, so make sure you print this out and put it where your other HR posters are, and don't forget the affirmation, and always go to this website for more information. A couple of other things, just to move quickly. If you're in a region or a phase that hasn't opened, say you're an amusement park in phase 4, but you have construction work to do on your premises, that's open in phase 1, you can do construction work on your facility. If you have any compliance questions, there are local regional control rooms we've heard about. There's a website for those. ESD is developing it. I can change that now. They have developed a system where you can put in your NAICS code. You can Google that and put it in your county, and they will tell you if your industry is open or not. You know, if you're looking, if I'm a barber shop, I want to find out if I'm open, you Google the NAICS code for barbershops, put that number in this website at Empire State Development Corporation, and it'll tell you what's open and what your restrictions are. And then a key thing about municipalities in this, we've had some counties, it's kind of dying now, but some counties try to impose their own requirements on businesses in addition to what the state did. They are not authorized to do that. So if you have a county say, you know, you have to submit your plan to us before you reopen, they are not permitted to do that. That's not a requirement. They are involved in oversight and enforcement. And as I mentioned, violating certain parts of this could be violations of the public health law, and you could be subject to fines, but they can't pose additional standards on you. A couple of quick HR considerations that I hear a lot, consistent from our members, consistent across the board in industries. Who comes back first, right? How do we decide? Say we've been closed and now we want to bring employees back. I don't make a distinction between layoff, furlough, and termination. These are all former employees. I like to refer to them as claimants now with the unemployment division. But when you're thinking about calling people back, you know, it's like, I want to call my employees back. Well, they're not really your employees anymore, but we're going to bring them back. Who comes first? This is almost like we're rehiring people for the first time. So we should apply the same rules and regulations we do in hiring to the recall process. So you should have objective business-related criteria for who comes back when. This isn't our opportunity to get rid of Bob, who's been a pain in our neck for 20 years. We laid him off as part of the pandemic, and we're just not going to call him back. We're going to call everyone else back. Well, if Bob is older, he could have a claim of discrimination based on age, which leads me to the next bullet. Don't discriminate against older workers in your recall. There is no Matilda's law, as the governor mentioned. He made that up in one of his press briefings. If you were to bring everyone back except people who are over 65, clearly age-based discrimination, and you would lose that argument. Be aware of reasonable accommodations. Just like if someone came in during an interview process and said, you know, this job requires you to lift 50 pounds, and they say, well, I have limitations, but I could with assistance. We have to listen, right? Well, if we're bringing employees back and we say, you know, Bob, we need you back Monday. Okay, I'll come, you know, I'm worried because I have COPD or diabetes. Now we have an individual, an applicant with a disability who's asking for an accommodation, so listen for that. And along those lines, be careful of pre-employment health questions, right? We can't call our former employees, now claimants, and say, hey, Bob, how's the COPD? How's your wife's cancer doing? How's your heart disease? We can't ask that of applicants when we're interviewing them, right? So we can't ask this of individuals who are calling back. So be wary of those normal HR concerns when you're hiring people. Another concern we see consistently is the CARES Act. We are in competition with the unemployment system to bring some people back. We can call Bob and say, Bob, great news. We're back to work. We're open June 8th. Bob says, that's great, but I'm making more on unemployment. The weather's nice. I'm sitting on my deck. I don't want to come back yet. We need to remind Bob, first of all, that those additional payments end on July 31st, as of today. And the old rules of unemployment still apply. Bob, who is a claimant, must be ready, willing, and able to work and actively seeking employment. And if a claimant refuses rehire or fails to report to work, they could be ineligible for benefits. This is right from the unemployment law. In fact, the PPP program, the Paycheck Protection Program, put out some new guidance recently to address this issue, right? Employers were having trouble getting people back. Am I going to be penalized in my loan forgiveness because of that? And they said, no, if you do certain things. If you make Bob an offer in writing, Bob refuses, document that refusal, and then within 30 days, you have to notify your state Department of Labor. So you have to do this to protect your PPP loan. And I think it's the right thing to do for the unemployment system, right? Whether he continues to get benefits or not is not our call, but we have to let UI know that he has refused a qualified offer of employment. You do that in writing, unless you're on the UI system and have your own password, which I suggest everybody do, by the way. But if you don't have that password, you do it in writing at this address, or you can fax to the Department of Labor, because it's still 1986 at the Department of Labor and they look at faxes. You're going to have employee relations concerns with Bob, right? So now Bob's back. He's paid less. He's not sitting on his deck. He's in there working for you. We're going to have to keep an eye on Bob's attitude during all this. But we're within our rights as an employer, and it's the only leverage we really have to compete with unemployment in this case, is to notify UI that we made a qualifying offer. I'm going to spend just a couple of minutes on some of the highlights of the paid leave programs. We are 6-8 weeks into this now, and you guys have become experts on the new paid leave issues that are out there. But I'll just point out a couple of things. One, paid family leave, plain old regular New York State paid family leave. The Workers' Comp Board changed the definition of serious health condition to include a COVID-19 diagnosis by a healthcare provider. This is a temporary rule only in effect for 90 days and expires June 25th. So that means today, if my mother-in-law, if my grandson, if my grandparent, any of the people who I'm eligible to use paid family leave for, if they get a COVID-19 diagnosis, I could use PFL for that. So be aware of that if employees are saying, oh, my wife has it. How can I get time off to care for her? PFL is an option, but only temporarily. Now, we talk to the board all the time, and we're hoping this ends on June 25th, just to remove some confusion. I'm not so sure that'll happen. As soon as we get word, we'll let everybody know if that rule is extended. We all know New York State's emergency paid sick leave, that was designed to provide 14 days of 100% income if you were quarantined. 14 days was the magic number back in March. It's done through a combination of paid sick days and a supersized PFL DBL benefit, right? Where DBL was greatly enhanced up to $2,000 a week above its normal $170 a week. This is for COVID diagnosis, and this is for those quarantined by a public health official because of COVID-19. You can't be quarantined for anything else. Say you were quarantined for tuberculosis or hepatitis C or something. I don't even know if they do that anymore. But if you're quarantined for anything else, you don't get this. But if you're quarantined for COVID, you get this. And you get this forever. There's no sunset date on this. So if COVID comes back next year, this is going to be with us for a while. As you know, the feds came up with an emergency paid sick leave program that you can use for more reasons than just a public health official quarantine. Excuse me. It only applies to employers of 500 or less because the cost of this is reimbursed by the federal government. I'll get to that in a second. This program, by the way, ends December 31st, 2020. So there is a sunset on this bill. We're seeing a lot of this now. The emergency FMLA expansion. If someone needs time to care for their child because the school's closed or their child care provider is no longer available due to the pandemic, they're eligible for paid FMLA. Now, here's the confusing part. This only applies to businesses with less than 500 employees. So that means it applies to employers of 0 to 50, people who have never had to use FMLA. They might not know what FMLA stands for. And now all of a sudden they have employees requesting this and they have to know how to implement and use this. This is a challenge that smaller employers are going to have to deal with and get used to doing. Employees can get 2/3 of their pay for up to 10 weeks for this. The key thing we're seeing here is you have to be working 30 days immediately begin prior to your first day of leave request. So if I've been laid off for 2 months, I come back yesterday, June 8th, and today I say I want 10 weeks off to care for my child, I wouldn't be eligible. I'd have to work into July. I'd have to work 30 days before I could use the enhanced FMLA. Again, this also ends at the end of 2020. Certain industries can exempt themselves from the federal paid sick leave and the federal FMLA if you're a healthcare provider or first responder. And there's definitions here. Again, you'll get all these slides. I'm trying to go fast to leave time for some questions. So if you're a healthcare provider or first responder, you can exempt yourself from the federal leave programs. You can also, if you're a small employer, exempt yourself from the federal leave programs. If you can show that providing these benefits, because the employer pays these benefits, right? If paying these benefits is going to cause you irreparable financial harm, or the third bullet, leaves you with not sufficient workers to be able to do your core function. So if I'm a daycare provider and I have a ratio I have to maintain from providers to students, and I get too many providers asking for time off and I can't do my business, I can exempt my company from this federal paid sick leave and FMLA requirement. As I mentioned, the federal paid sick leave and FMLA are reimbursable. As an employer, before you submit your quarterly 941 forms and all your withholdings to the IRS, you get to keep 100% of the cost of providing these benefits off the top. Again, I'm not a tax expert. The IRS, to their credit, has a really good website. The link is on this slide that you'll be getting from me. And then the last bullet I want to mention from an HR perspective, because I've talked to the Department of Labor, warned me and told me to tell people that one of their points of emphasis in all this is the Wage Theft Prevention Act, right? They've always been concerned with wage theft. And as you know, the Wage Theft Prevention Act requires that we give every new hire a wage acknowledgement form that indicates their rate of pay. I would give everyone who's returning to my company a wage acknowledgement form. And significantly, a loophole that the department has latched onto is that if you reduce someone's pay, you need to provide them with a wage acknowledgement form. And we have had some employers who, as a strategy to get through this crisis, has said we're going to reduce everybody's pay and we won't have to do layoffs. You need to provide wage acknowledgement forms to everybody who had their wage reduced. Failure to do so can lead to fines and penalties. And as you know, Wage Theft Prevention Act penalties are significant and add up quick. They also have criminal penalties associated with them, misdemeanors and felonies. For HR people, I've seen business owners mugshots. So you want to make sure you're doing wage acknowledgement forms for people for whom you've reduced their pay. As you know, there's a whole bunch of websites out there that are helpful. You want to go to Walsh for information. The Business Council has sites. The governor's website, I mentioned, forward.ny.gov is getting there. They start out having some trouble coordinating the different information, but they're kind of getting there. Go to the OSHA website. That's one of my favorites. I'm a big OSHA fan. They give you a lot of resources as well. And questions can be directed to myself as well as Stephanie. So that is what I have for a presentation. So we'll bring Stephanie on and see what kind of fascinating questions you guys have come up with.
Yeah, we have some great questions.
Oh boy.
So the first one is, are face coverings required if there are physical barriers between workers?
The bottom line is to protect droplets from one person to another person. So if you have a workstation where barriers are put in place and achieve that goal, then you could forego wearing face masks in that situation. Now, if you leave that environment, you have to put your mask on. It even says in some of the guidance, I know in the office guides, for example, if someone unexpectedly comes into your area, you have to be prepared to put a mask on. So we're all going to have our masks handy, right? But to answer that question specifically, that barrier would serve the purpose of replace the purpose of having to wear a mask.
Okay, so the next one about masks as well is, if someone comes in with a mask on and it has pictures or a saying or something that could be offensive to other employees, can you ask that employee not to wear that mask?
Yeah, just like T-shirts, dress codes, other form of offensive clothing. Absolutely, they don't get a pass because it's on a mask. It's open season on all sorts of offensive sayings or slogans. So absolutely, this is part of your dress code enforcement now. And just like anything else, and they're going to wear a paper mask until they bring in something else to wear.
Okay. So you mentioned competing with unemployment and the PPP, but what happens if you have an employee that can work from home? You want them in the office, but they're very uncomfortable with coming back. Can you terminate them?
Fear isn't a disability, unless it is a diagnosed anxiety disability. If your organization requires people to be in the office, regardless of how well they performed at home, and you as the employer have decided that our workplace is safe, we want people here in the office working, and you refuse to do that, then you could be forfeiting your job here because of that. Again, you need to listen, right? If it's anxiety and they're seeing someone for it, and they use phrases like that, that could indicate an individual with a disability asking for an accommodation. But absent that, if it's just, I just don't want to come into work, I like working at home better, which is my scenario right now, that's not going to wash. My boss will tell me to be there, and I'll go and be there.
So what if you're asking employees to take their temperature at home and certify that they're okay, and they tell you that they don't have a thermometer? Should employers be concerned about that? And also, should employers be concerned about the accuracy of at-home thermometers?
And this is exactly why we call into question the effectiveness or the worthiness of taking temperatures in the first place. Exactly that. Everybody's home thermometer who knows what technology is being used in the homes, right? In the accuracy of those thermometers. And that's why I think employees bear a large responsibility in this, and doing a self-assessment. And even if they showed up at our facility and checked on a form, they're doing a self-assessment, right? Even if they check when they come into their office or return an email or use an app, there's a lot of technology out there. They're doing a self-assessment, and they have to understand it's their responsibility. We can't verify the accuracy of all our employees' thermometers. That's not our role. It's impossible. If they say, I don't have a thermometer, say, well, you know what? You're responsible for, by coming here today, you've attested that you don't have a fever of 100.4. How did you do that? Or are you here inappropriately? If you can't take your temperature, then you can't come to work because you can't attest that it's less than 100.4.
So that kind of leads to this next question. So if someone says that they're fine, they're at work, and they have a cough, and the cough goes on and on. At what point do you as the employer say, okay, that's alarming to us?
Again, we're not doctors, right? And we can't try to be doctors. So if we have a cough that is disruptive to the workplace, right, meaning it's causing fear, or people are concerned, or it's gross, it's leaving a mess, if it's disruptive to the workplace, we can send someone home anytime. Go home. I don't like what I'm hearing. Go home and don't come back until you can show me that you're okay to come back. And then how they do that is up to them as well. Are we going to request a doctor's note? Maybe not. But we'll work with them to try to find out, you have to reassure me as the employer that you're okay to come to work. But I would send people, and I would have a shorter leash during the pandemic, right? Pre-pandemic, gross coughs you would put up with for a while. But now I don't think I put up with them as long. And if I hear that, I'm like, you know what? You're done. Go home. We're within our rights to do that. If you have a union, check with your union to make sure that this is your process. But the non-union environments, we're going to send people home.
So what happens with employees who use private daycare or child cares and they're not comfortable sending their kids? Would they be covered under FMLA?
The enhanced FMLA requires here's the ultimate issue, is that we as an employer want to be reimbursed for that FMLA, right? Expense. We're going to pay it, so we want to be reimbursed for it. If that's the case, we have to show the IRS that it was a legitimate use of FMLA. To do that, I would want to get an attestation from that individual that they were the primary caregiver, that it wasn't just the whole family sitting home getting 2/3 of their pay because that's what they want. I'd want an attestation that they're the primary caregiver, and that the daycare was unavailable due to the pandemic. Now it's available in your scenario. They're just choosing not to go there. So that probably increases the chance that the IRS won't reimburse me my money. So I'm not going to approve that FMLA.
Okay.
Unless
So,
you're comfortable just paying it,
right.
and not getting reimbursed. You can have a different standard then.
Are employers allowed to tell employees who has the virus in the workplace?
We always want to maintain as much confidentiality as possible. I'm always convinced employees know everything all the time. There's no secrets in the workplace. If it's necessary to protect people and to clean working environments, I'm okay telling names to get it done right. Are we obligated to? I don't know if I'd make it a habit of broadcasting names of everybody who tested positive. I would only reserve that for situations where I need you guys to move because this work area, who you know is occupied by Bob, needs special cleaning because Bob was COVID positive. So again, it's going to be a case-by-case thing.
So just to clarify, the New York State wage acknowledgement form should be completed by those returning from furlough with no break in employment or change in rate from prior employment?
I'd argue that a furlough is a break in employment. I mean, if they were out receiving unemployment benefits, they clearly weren't employed, right? So if you're furlough, to me, a furlough is a termination with some benefits to try to get the person from going to get another job, right? We're going to continue your health insurance for 90 days, or we're going to do something to try to keep you in our family. But to me, they're reemployed almost as if they're reemployed off the street, and that would trigger a new wage acknowledgement form.
Steph, we might just do one more, and we've got many, many more questions, but we won't get anyone to come back to the next one. So maybe one more question, and then we'll send out answers to all of the questions.
Be glad to do that.
So if an employee, if we recall employees back from temporary layoff and do not adjust their hourly rate, do we still need to reissue the New York State wage form? Is that what I just
I'm just more comfortable doing it.
Yeah.
If you don't, in the same terms and conditions of apply, if it was a 1 month layoff, all right, that's probably good. Was it a 3 month layoff? That's not as good, right? It's not as relevant. I don't see the harm in bringing people back and doing new wage acknowledgement forms. And I know what the risk is, and the risk is serious penalties for not doing that. So you can weigh those two.
All right, thank you. And Ted, I'll turn it back over to you to wrap up. Thanks.
Okay, thank you, Steph. And a special thank you to Frank for sharing your insight and your expertise today. And we're very excited to all of you that participated and joined today's webinar. I promise we'll send out answers to all the questions. We'll send them to everyone. And as I mentioned in the beginning, this has been recorded and we'll share the content as well. And I encourage you to reach out and talk to any of the Walsh-Duffield team. We've got lots of rich resources here. We'd love to share anything we can to be helpful as we all start to get more people back in our workplace. As you know, we're doing these webinars every Tuesday, and we're very excited. The next one is, next week is going to be Kinsey O'Brien, who's a senior associate at Hodgson Russ Law Firm. And the topic is how bad investigations make harassment claims more likely and less defensible, something we can all learn from. If you want to know more about the presentations, our presenters, or what the topics are, please visit walshduffield.com/webinar. If you have any questions, please reach out to the team. We're very excited that you joined us today and wish you all a terrific rest of today and the week ahead. Goodbye.